All right, guys, welcome back for section 2. This is going to be part 1. Section 2, there's going to be 4 episodes again, like in the last section. Today, we're talking about bony anatomy. Next week is going to be more about muscles. Then we'll go into nerves for part 3. And then part 4 is going to be the good stuff, like what can you do about issues in this area. So today, it's going to be about lower cervical segments, upper thoracic segments, ribs, just the bony anatomy in that region. Let's go ahead and take a look at the spine here and just make a general note of the curvature, what's normal, and then we'll kind of zoom into these are called the facet joints. There's one on each side between each vertebrae, and that's true all the way up and down our spine. Now, this changes gradually. It's not like it goes from this angle to this angle all of a sudden. In the cervical, just think what I remember from school is that the angle went towards your eye, regardless of which section, which vertebrae you're on. So let's just say in the cervical facets, they're going to be at about a 45-degree angle. As we come down into the thoracic, we're more at like a 60-degree angle. So why do we even care about this? Well, it really helps us understand how the joints move when we move. It helps us understand how to treat them when they're not moving. So that's why it's important. Now, let's just talk cervical facets. So they're kind of stacked like that, one on top of the other. If we're looking up, so we're moving into extension on both sides, the joints are going to do the same thing. So that joint, the upper vertebrae, is going to slide kind of down and back like that. And the same would be true on the other side. So you've got both of them moving and your head's going to go up. Now, if it's rotation, you're going to get that sliding back on one side, but then on the other side, it's going to slide forward. So kind of picture that movement in your head. Now, when we do a side bending motion, there's a little bit of side bending and rotation are a little bit conjunct. So the mechanics are similar, but I would say the difference with side bending is that the disc, so let me pause right there. We didn't talk about discs at all in the upper cervical region because there aren't any. Those vertebrae sit right on top of one another. Now we're getting into where we've got discs. And even further off that, another movement we didn't talk about with the 0-1 or the occipito-atlantal joint there is a little bit of side bending. So we get a little bit of this movement from that 0-1 joint. If I just go ear to shoulder, that's going to come from multiple segments. And the disc really helps us get that, along with the movement at the OA, the 0-1 joint. So let's look at this little area. We'll just pick one of the vertebrae and zoom in here. These are called the uncovertebral joints, aka the joints of Luschka. That's way sexier, right? But we'll stick with uncovertebral. So those slowly, with normal aging, but this can be accelerated with osteoarthritis, like they grow towards the vertebrae that is sitting above them. So what does that do? It's gradually going to start to limit our ability to side bend or get lateral flexion. So that's a motion that's going to go away even before we start to lose rotation or extension with osteophytes or osteoarthritis of those uncovertebral joints. Now, I don't want to get too far into this right now, but let's go ahead and spin around to the side of the vertebrae. And there's this little space that's formed between two vertebrae sitting on top of one another. And that space is where the nerve root's going to pop out. So the reason I think of this now is because we're talking about side bending. When you side bend, you're going to close down. You're going to load the facets on the side you're going towards. You're also going to narrow that space where the nerve root comes out. So that that can be a big issue with what's called radiculopathy or even just radiculitis. Radiculitis is irritation of a nerve. Radiculopathy is true compression where you lose strength, sensation, reflex. We'll talk about that more when we get to the episode about nerves. So then let's also, another view we're going to spin. So we're looking kind of up through the vertebrae towards the head. There's another little hole there. And this one is called the first one where the nerves comes up, that's the intervertebral foramen. If you guys are super interested in the names, I don't know. Now, this one is called the transverse foramen. And this is where the arteries course their way up so they can get and supply stuff here in our brain. And I didn't get into this with the upper cervical segments either, but when the vertebral artery, a test that we use in the clinics is a full rotation and a little bit of tilting to put some tension on that vertebral artery, and that can tell you if there's an issue there, like if somebody gets dizzy with rotation or their speech changes or something, then that's a referral out. I mean, that's not somebody that I as a PT am gonna work with. They need to go get some other medical advice, imaging, whatever it might be. Okay, and we'll talk a little bit more about that when we get, when I got the vasculature in there, you'll be able to see where all that stuff runs. All right, let's keep cruising down. So the joint mechanics in the thoracic are just like what we talked about for the cervical segments. That it's just the joint plane is a little bit steeper. You're more at that 60-degree angle. But the same is true at those thoracic segments. If you're moving into extension on both sides, that upper vertebrae is going to slide back on the lower one. If you're getting rotation, you're going to get one that goes up and one that comes back, and that's your rotation. Now, so as far as the joint surface goes, if you improve, like extension is something we have trouble with in the thoracic. So if you can improve extension, it's going to help with your rotation. If you can improve rotation, it's going to help with your extension. Now, there's other things to consider in there for sure. We got all kinds of muscles and ribs, and that's where we're going next, actually. So let's go ahead and take a look at the ribs here. So on the back, you've got so as the ribs come around the back, they actually attach onto two vertebrae. And you can see this on the image there. There's a little bit of an articulation with the attachment to the higher rib is smaller, but nonetheless still there. So it seats in like that. And then it cruise out here. That rib angle also articulates onto the transverse process of the lower vertebrae. So do you need to remember all that? Not necessarily. The point here is that there are a lot of little moving parts in there, and this can kind of be a progressive thing over time, kind of a domino effect. So you got stiffness let's say you got stiffness between the T5 and 6 vertebrae. Well, then that could start to restrict their ribs' ability to move. So when you take a deep breath in, those ribs need to kind of rotate up and allow for that expansion. So you may have just started out, again, back to the desk worker idea, or the desk worker example. You're kind of slouched forward. Those thoracic segments, those thoracic facets are going to get stiff, and then it starts to affect the ability of the rib to move. And that can just be a feeling of restriction with deeper breaths, but then with coughing or sneezing, it can actually be pretty sharp, like pretty uncomfortable. But the good news is we can mobilize that stuff, kind of restore its ability to move and get that pain to go away, get you moving better. So that's good stuff. So that's all the stuff on the back there. Now let's spin around to the front. These are the sternocostal joints, and you can see kind of how all those hook in there. There's quite a bit of cartilage around all of them. And again, that's so that we can open our chest up, get some expansion to pull some air in. So lots of cartilage. We have seven of the ribs we would call true. And then you get down to 8, 9, 10. There's quite a bit of, they don't go straight to your sternum there. They go onto this cartilage and then they hook onto other cartilage and then they come up. And then you've got the 11th and 12th rib, and they're just kind of, we call them floating ribs. They're just kind of out there. They don't hook on to anything, but we need them. They protect stuff. All right, guys, that's going to do it for episode 1 of section 2. Stay tuned. Next week, we'll talk about muscles in this same region.